Next up is Zheng with Captis Diagnostics.
Lung cancer is by far the leading cause of cancer death. Tissue biopsy is often required for patients to receive precision treatment based on the biology of the tumor. However, it is only available for less than 50% of the lung cancer patients. As another example, pancreatic cancer has an abysmal 1-year survival rate of less than 20%. The poor prognosis is largely due to late diagnosis. At Captis, we have an ambition to transform cancer diagnosis and patient care through non-invasive blood assay, the liquid biopsy. In general, there are 3 categories of liquid biopsy based on the materials released by the tumors into circulation. They are circulating tumor cells, CTC, circulating tumor DNA, ctDNA, and extracellular vesicles, EV. EV is the newest and the most promising category. They are sub-micrometer vesicles released by cells and contain rich information, including DNA, RNA, and proteins. They are our focus. We invented a patent-pending technology, the lipid nanoprobes. It is a groundbreaking nanomaterial-based EV isolation platform. It does not require any bulk equipment. It can achieve over 80% EV isolation efficiency in less than 15 minutes and remove over 99% of the plasma proteins. Our first product will be this exact EV isolation kit, which will be available later this year. With this unique EV isolation platform, we will combine it with mutation detection as a liquid biopsy kit. We already successfully demonstrated EV-based mutation detection from clinical plasma samples using both PCR and sequencing. Our second product will be a targeted therapy selection kit for lung cancer. The next 2 products are diagnostic kits for pancreatic and lung cancer. The liquid biopsy market is booming. It is projected to be a $4.43 billion by the year of 2025, with an annual growth rate of 23.4%. As an example of market potential, Exosome Diagnostics, a US company, recently raised $100 million from VC. As for competition, there are only 2 FDA-cleared products. One is based on ctDNA, the other on CTC. There's no EV-based products. We have the competitive advantages to provide much more and accurate information. Captis currently includes myself and full-time CEO Simon. We are pleased to let you know that within the first 3 months of operation, we already acquired an NHSBI grant to further develop our technology. We are excited to have the opportunity to become a successful Penn State startup. Thank you for your attention.
So early detection, non-invasive, low cost, what's not to like? I think the question is around, can you talk more about where you're at with proof of concept? Does this work?
Right. So for the technology itself, this is the EV isolation platform. We demonstrate this, we optimize this, we published this in the Nature Subject paper last year. And then in the same paper, we actually did some feasibility study using patient plasma samples from non-small cell lung cancers, and we can successfully detect those mutations. And then we are scale up the studies to do more clinical tests to really get the sensitivity and the specificity. And then we actually have some preclinical data, not using this technology. We use conventional ultracentrifugation, so that's not the best technology. So we are already showed in our study, compared with circulating tumor DNA, we got better sensitivity for early stage cancer patients.
One question, if I may, from a competition perspective, again, this is a hot area, a lot of companies trying to get some success in the same field. I have seen a European company, I can't remember the name, it's a French or a British company that's using the same EV technology that you highlighted. And if you can help us understand, in your early progress, what is the sensitivity like? Are we talking 80% plus, 60% plus? Where is roughly the starting point on
Right.
sensitivity?
So I come back to the study we conducted. In that's actually before we developed this. So it's using ultracentrifugation. We are using that. And then we know for ultracentrifugation, the isolation efficiency is less than 10%. We can achieve 80%. For that technology, when we do first and second stage lung cancer, we got 25% sensitivity compared with 15% sensitivity from circulating tumor DNA
Right.
at the specificity level of 90%. For late stage, stage 3 and stage 4, we can achieve about 85 to 90% sensitivity at above 90% specificity. But again, this is using ultracentrifugation. So we do expect our new technology will do much better job, but we don't have the clinical data yet.
And what's the sequencing platform you're using right now?
So for the sequencing platform, it's really dependent on what's the end target. For the targeted therapy selection kit for lung cancer, we are using digital droplet PCR.
Digital droplet PCR.
Digital droplet PCR. So we can get exact copy number. And then for diagnostic kits, we will need to run sequencing. So again, depending on the cancer type. For pancreatic cancer, we probably need 4 genes. For lung cancer, we need a gene panel of around 20 genes. Yes,
So I believe you said you've received a grant.
that's right.
Will that cover your next study?
It's a good grant for us to start, but frankly speaking, I don't think the NIH SBIR grant is good enough for us to really quickly develop technology. So we are actually also looking into angel investment or VCs at the same time. Yeah. Again, we only started our operation January this year, so we are very very young, but we are on that track.
I think you were a month longer than one of the other companies.
Probably. That's right.
Just if we have a little bit, if you can talk a little bit about the size of the organization at this point of time, and what are some of the initial strategies over here? So what's the next step?
Right. So currently, company include myself and full-time CEO Simon, who used to work on this technology. He's a postdoc, and then we are actually actively recruiting. We do have 2 clinicians from Hershey as our advisor on medical side. The next step, what we are thinking is we want to develop we will have the first product, the isolation kit, available later this year. We will develop the diagnostic kits, first the targeted therapy selection kit. And then after that, we will establish a clear lab.
Clear lab, okay.
We will do that because this is a growing market. We really need that so that we can work with medical centers to really run clinical samples, to run feasibility studies. Very good question.
With that, we're out of time. Thank you.